Hello there, and welcome to your medical massage session, also known as a remedial massage. Now, would you mind telling me a little bit about what it is that I am seeing you here for? Okay, and would you mind telling me just a little bit about that? Okay. And on a scale from 1 to 10, with 1 being not bothersome at all, and 10 being the worst pain you've ever experienced, how has this been affecting you? What's your pain level been? Okay. And any sort of restriction in movement then? Very good. And any known injury or past surgery to the area? I see. All right. Well, we can certainly work on that for you today. Generally, when we're working with any sort of pain, it's not going to be something that clears up in one day. It's going to be something that we are going to sort of strip away and bit by bit get a little more movement, get a little less pain, get it a little more into a healthy state. So today we're just going to kind of look around at it and try to feel out our boundaries and hopefully get a little bit of that edge taken off, right? Very good. So for this massage, I am going to need to be touching you. Is that okay with you? Good. So let's have a chit chat real quick about the anatomy of the area we're going to be working in, just so that when I throw terms at you, you have an idea of what's going on. Okay? Alright, so the upper arm, the shoulder area here. So first let's take a little gander at the bones. We have the upper arm bone. This is the humerus. We have the clavicle. And we have the scapula, the shoulder blade. What we know of as the shoulder joint is actually the head of the humerus, and it connects into what's known as the glenoid cavity. It is a fossa in the scapula. A fossa is a depression. So for example, the crook of your elbow is the cubital fossa, right in here. So it connects into the glenoid cavity of the scapula, and that creates this ball and socket joint that is known as the shoulder. In terms of muscles, we have a lot going on here. We have biceps, triceps, brachialis. We've got a few different muscles in the shoulder area itself. We have supraspinatus, infraspinatus, teres minor, and subscapularis. And then we've got some more muscles that help the arm move and rotate, flex, whatnot. We have the trapezius, pectoralis major, pectoralis minor, teres major, the rhomboids, levator scapula, all these different pieces that help your arm do all sorts of things, right? Okay, so we are going to look into all of these muscles and see if there are any dysfunctions in any of those and track it back to the source of your pain, right? Okay, so let's do a little bit of a physical assessment and we can maybe narrow down what's going on. So let's go ahead and start with the hands, the fingers, the wrists, and I'm just going to have you do a few exercises for me. I could have you make a table here, just like this, and if you could try to just curl in the first couple joints, okay, and what about all the way? And make a fist. Good. And splay out the hands. Very good. And how about the wrists? Can we move them up into extension, flexion? Okay, can we rotate them in and out? And can we roll them all around, inwards and outwards? Get a lot of cracking going on. Good, okay. And with the elbow, can you just bend at the elbow? Not bending anywhere else. Bend at the elbow, up and down. Okay, and can you bring your elbows? Let the upper arm rest at the side. Bring the elbows so that your hands go outwards. And can you bring them inwards? Across your body. Okay, and how is all of that? Alright, so we're going to get more into the shoulders. If I could have you bring your arms all the way up and all the way back. Okay, can you have them perpendicular at your sides? And then can you bring them up and touch the backs of your hands together? Good, okay. Can you take one hand and try to put your thumb as far up your back as possible? Yep, so that your arm is tucked behind your back. And then the other side. Good. Can you bring your arm across your body as far as it'll go? And the other. Okay, and can you roll your shoulders around, back and forth? Good, so how is all this feeling? Okay, so now I'm going to do a little bit of passive range of movement with you. I am going to be taking your arms, your hands, and moving them around, okay? Let's start right here. I'm going to move the fingers, deflection and extension, and the wrist. Rotate. Good. And then the elbow, just going to bend in here. In. Right? And we'll move in. And out. Good. Now if I could take your arm, we're just going to bring that up. Let me know if any of this is particularly sensitive or painful at all. Good. Let that come back down. And do the other side here. Fingers, your wrist, good, elbow, just support the arm. Good. So far what I'm seeing is not too bad at all. I think this is something we won't have to be nearly so gingerly with if we have an established injury or surgery. And I'm just going to move the arm and do some movement here. Good. Okay. Now we're going to do just a couple of resistance tests here and a special test just to make sure that we're doing all right. So I'm going to have you splay your fingers. I'm going to try to press them together. Good. And I'm going to hold your fingers together. I want you to try to splay them against my resistance. Very good. And I'm going to have you hold your hands like this. Try to bring them up. Good. And if you could cock your wrists back, try to bring them down. I'm going to try to resist you here. Good. Now if you could make a couple of arm bars here, I'm going to try to push you. I want you to resist me. And I'm going to try to pull you. And I want you to resist me. So we're going to try to push you. And I'm going to try to pull you. How are we doing? Okay, very good. Now I am going to have you do a special test here. I want you to pretend you're holding 2 cans of soda pop and have your arms out to the side. I want you to flip them over, and I'm going to press down on your arms here, and I want you to resist me. Keep the arms up. Okay, very good. You can put your arms down. Now what I think we're going to do is we are going to start with you lying down on your back, and we'll start working into the chest, neck, arm, and a little bit even into the head region. We'll get this area warmed up, and then we'll start doing some work into the shoulders. Okay. I'm just going to put a few notes regarding your testing. And then let's go ahead and get you set up. Are you comfortable in this position? Good. And is there anywhere you feel like you might need a little bit more support, like with a pillow? And how's the draping? Is that all right? Good. So, in order to see you better, I'm going to pop on my glasses here, and I'm going to grab a little bit of cream. We're going to start by Just dispersing our massage medium. And we will work that into all of our areas here. So, I don't remember if I mentioned before, but your shoulder joint is called the glenohumeral joint. We talked about the glenoid cavity and the head of the humerus. So we're going to do some work with there, but I want to get a good hands-on assessment of the surrounding areas as well. That way we can see how isolated your pain is, because often a pain in the shoulder means that it might radiate up into the neck, or we get pain in the arm. Sometimes our neck is really tight and that causes problems for the neck and the shoulder. I mean, everything's related. We're just going to warm this area up, and then I'm going to start working on one side and then the other. I'm just going to feel things out here, doing this sort of outlining of our different areas. The clavicle, the coracoid process in here. We have glenohumeral joint. We get into the scapula a bit, just noting our borders. And then I think I'm going to start with the chest here. So we're going to have some support and a little bit of squeezing in with the trapezius muscle while we're working with the chest as well. All of this is connected. These sort of long strokes here. Good. And down here. Then we can get into the trapezius and the shoulder. So even though this is the area that is giving you the most trouble, I'm not going to get really deep in there today. What I'm going to do is get around, touch on it a little bit, see if we can ease the tension and maybe some of the holding patterns in the area, so that in subsequent visits we can get deeper and deeper in there without using a lot of heavy pressure, without using, digging my fingers in there. That's not what we want to do. we are untangling a big ball of yarn, essentially. If you yank on the string, really pull it, it's not going to come out for you. A lot of times those knots just tighten. But if you go at it with a more gentle approach and you really look at it, rub the strings between your fingers to try to find where it's knotted, it's going to be a lot easier. So I am going to compress the joint here by compressing the head of the humerus in that joint. And we are going to work with a bit of movement here. I'm just using my own body weight and movement to work with that compression. This is a very gentle way to get a little movement in the joint while preventing any pain from springing up. And do let me know if it's more sensitive or painful, tender, any of that, alright? I hope that you would. Just want to remind you. Good. Just moving that around. Getting a little bit of movement here. Then we can work in this little space of tissue. We've got the coracoid process and the clavicle. Work a little in here and bring that to the deltoid muscle around the shoulder there. It's the most superficial muscle. And then we can work a little bit underneath as well. And we can get into the scapula. And I'm not trying to force my fingers in here. I'm just seeing what it will allow me and working around its borders. See what the tissues are going to let me do. Good. So I am going to take your arm here and I'm just going to place this so your hand here is in the crook of my elbow. So we have a little bit of support. And I'm going to use my body's movement to get a little rotation in here. So we'll do a bit of rotation. And then we'll get a little bit of compression and rotation. I'm just going to put my body against your forearm so that it's compressing the humerus into that joint. And then I'm going to just press your arm against me here so that we can get some compression of the humerus in that joint. And do our rotation. But this can help prevent any pain from springing up while we're doing a little bit more in here. And I'm going to move to your other side. So now I'm going to work back into the chest and the other side. Do the chest and the trapezius. Good. I'm going to stretch this all out, warm it up so that we're not having anything tighten up on us. Here. Squeezing the trapezius at the same time. Working more into the shoulder and the trapezius. Getting a lot of movement in there. I tend to try to use more my body weight as opposed to making my arms do the work. It saves my muscles and my joints a little bit more. It's the little things, trying not to use your thumbs as much. Trying to keep good posture. And then I'm going to compress the humerus into the glenoid cavity there, compress the joint, and then we can work a little bit more in there. And get a little bit of pressure. A little bit of rocking here. How are we doing? How's the pressure? Good. We can get into the coracoid process. Work that and the clavicle over into the delt muscle. I'm not feeling really any sort of any difficult areas, I guess one could say. I mean, there's certainly tightness, tension, a bit of knotting. Fascia's probably a little stuck in places, but Nothing out of the ordinary. There's nothing that I think is going to be particularly challenging. And we can get underneath and work with the scapula here. A lot of our shoulder issues we can see in some sort of dysfunction of our main shoulder muscles. Are we having issues with supraspinatus, infraspinatus, teres minor, or subscapularis? These can get pretty bunched up. And we can just inch by inch work into these. And not just target what's wrong, but make sure everything else is in a good position as well. I'm going to take your arm. Again, drape it on the inside of mine here. We'll sandwich your joint here between my top hand compressing down, my bottom hand compressing up, and then doing our rotation here. And that way you can get some movement, not to the point of your restriction, not to the point where it's going to hurt, but just to make the area understand it can be a little more open. The body does these sort of holding patterns and guarding because it's learned if it does one movement that it is going to hurt, and it doesn't want to do that. Pain signals that something's wrong and it shouldn't do that. So it makes sense. It's logical. It doesn't mean that it's healthy. Now with this compression of the humerus, we can get a little more. A little more. And I am going to have you flip over onto your stomach, and we're going to work on the posterior side of the body. Is this positioning comfortable for you? Okay. And everything feels supported? Very good. Let me know if I can make you more comfortable at all. And we're going to work on the back here. Just going to get a little more of our cream. So while we want to target the shoulder, obviously, we don't want it to feel like we've only worked on the shoulder. We want it to feel like we've been much more thorough. So we are going to get into the thoracic area of the back, as well as the arm. And then here, and we can do some slow pressures that advance quite slowly, They're technically a stroke, but they move so slowly and have more pressure than that. And with my other hand, I've just got a little bit of traction here. So we get a little bit of stretching as well. Using my fist, and this gives me some more broad pressure here. Is this pressure okay? Okay. Sometimes it can be a little intense for people. Good. Here, just smoothing this all out. Supporting, giving a bit of traction. And I'm going to use my thumbs up the back here, more of the lateral side. We can work into the teres muscles, some broad, sustained pressure here, working in strips. Work a little more medially for the infraspinatus fossa, or depression. And I'm just going to bring your arm, and we're going to put it off the table here. We get a little bit of rotation, and then work into the shoulder, since we've got a different positioning of the bones, the muscles. We can get into areas that we wouldn't have really been able to before. Not be able to access other areas as much that we already worked on. There we go. We'll do a little bit of work here, and then I'm going to bring your arm above your head. Birds and the trains. I don't imagine the birds will be as noisy in a bit. We're supposed to get quite a storm here. I'm just going to guide your arm up, reaching forward. There we go. Pressure's still good. flip to your other side. Over on this side, we're going to warm up this part of the thoracic as well as the posterior side of the shoulder, the arm. Let everything unwind a little before we get in there. We can get some of our traction using our sustained pressure with a bit of movement. One hand moving away, one hand moving toward. Little bit of a stretch. So something we want to keep in mind, our big sheet of fascia here. We have the latissimus dorsi, which I find to be a wonderfully named tissue because latissimus has the root, same root that the word latitude does. And it's the sheet that covers the whole entire sides here and the isthmus suffix there indicates that it covers the most widest part. And dorsi for the Latin word for the back, which is dorsum, at least one of the words for the back. Using my fist here, it's more the backs of my fingers as opposed to my fist. Yeah, that group of tissue, the muscle, the fascia, covers the widest part, the most widest from side to side. And I'm going to use my thumbs here. But that latissimus dorsi gets very easily bunched up. It gets very easily locked up, knotted. The fascia gets stuck. It's a whole thing. Even for people who don't have chronic pain, at least in their back, they often can get something goofy happening in that fascia and muscle. So it's good to stretch this area out when we can. Make sure to get enough fluids so that that fascia doesn't get dehydrated. That's when it gets stuck. Okay, more medially, working in perspective. It's just going to be a lot of fluids, exercise, keeping things flowing, essentially, as much as we can without causing ourselves pain that's not going to help. I am going to bring your arm down and we'll work in here. we'll just see what we can do to pare away at this. It is a bit of a slow-going process, but if it was quick, there's no guarantee that it'll stay that way, that you've been thorough, that you've changed those holding patterns and the guarding. So really, there is a slowness that needs to be expected. Obviously not too slow. There's not any progress being made. Then that doesn't make any sense, but if it's very quick, I wouldn't trust that it works well. Body is both extremely strong and very delicate. We'll bring your arm up over it. There. We'll get into those areas. We're not going to do that today, but we can get into you laying on your side, for example. We can really work like pectoralis minor, for example. That's a good one to get easy access to. And we'll just kind of play with it and see what we can get squared away for you. I'm going to bring your arm back. And I am going to give you a moment, and you can get your bearings, sit up, and we'll chit-chat a bit before I let you go. And how was all of that? Good. So, are you feeling any sort of lingering pain or soreness? Alright. So for the next 24 to 48 hours, you might experience some of that. I made sure that we weren't doing anything too specific or detailed, so that most likely that wouldn't happen, but you might get a little bit. And I am going to recommend some rest and making sure to get lots of fluids. And if you do experience some pain there, just a regular low-dose anti-inflammatory will help with that. Alright? Any questions for me? Okay, so I have a good idea of what I want to do for our next session. So if you want to schedule that with the receptionist, and I will see you next time. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, or a Throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your night.